video is on. I'm Jody Brockman. I'm an RN here at NKC Health in the Community and Wellness Department. And I am honored to have Dr. Tony Mendes joining us again for our second webinar. Today is dealing with chronic health issues. Tony is a Kansas City-based wellness coach and longtime educator. His career began with pioneering a corporate wellness pilot for AT&T, which later expanded nationwide. So he was a man before his time. He earned his doctorate at UMKC. He's had numerous additional accolades, all dealing with helping individuals improve their well-being and performance through wellness coaching practices. And I am going to turn it over to Tony. Thanks a lot, Tony. Good to see you.
Thank you. Thank you, Jody. So thanks for joining today. This actually is part two in a three-part series. In our last webinar, I pretty much covered the basics of wellness and kind of my perspective on it. And so today, we're really going to delve a little bit deeper into, why don't people live a healthy lifestyle? Um, it's not because of a lack of information. There's a ton of information out there. I mean, there are more podcasters, I think, than ever in history, talking about wellness and different aspects of wellness. Um, but so it's not a lack of evidence. It's not a lack of information. Um, and the reality is, the tragedy is that most people do want to live a healthy life. In our last session, I talked about the fact that 80% of US citizens over the age of 50, 80% have some type of a chronic illness. And as you get a little older, that number really goes up. So it's part of, it's a concern about our society. How do people not only get to live longer, um, but get to live with a higher quality of life? And we have good access to healthcare in the U.S. North Kansas City Hospital is a fabulous resource for the community, and they have people like Jody and her team that are there to help. I mean, they do their health screenings throughout the city, and every time I go to one, there's a line of people waiting to have their blood taken and their blood pressure and other biometrics that are offered. But the fact is that even when you go to a physician and he or she tells you, yeah, you've got this condition, and if you want to feel better and get better, here are some things you have to do. They just don't do it. And in fact, I think I've got a slide here. Yeah. So that's the dilemma for healthcare workers. They just, they know that people just don't comply. In fact, I taught this course at Rutgers University from 1992 to 94, and it was on facilitating treatment adherence. It was for the medical students and the MPH students. And it's kind of interesting because actually the book that I used, the textbook, was called Facilitating Treatment Adherence by Donald Meichenbaum. And one of this, it's just full of research articles. And one article that they quoted was a researcher by the name of Vincent, who reported that patients who were told that unless you use these eye drops, you're going to go blind, they only had a 50% compliance. So, and we know that compliance, the numbers are pretty grim. And that goes for a wide range of disorders, from psychotherapy, diabetes, hypertension, and then when you get into lifestyle type things like quit smoking and manage weight, the percent of compliance really goes down. So we know there are numerous psychosocial factors and a lot of ways that not only individuals but their the people around them and their surroundings sabotage them. So it's not a lack of resources. It's really a lack of understanding what the core issue is and then how to correct your lifestyle. So when we talk about compliance, that's basically when someone tells you, okay, here's what you have to do. You want to be healthier, you want to live longer, you want to live without this illness. Here's what you have to do. So it's basically giving orders. Um, and even though people value and respect their healthcare providers, their workers, um, they really don't follow up with healthy behaviors. Now, taking medication has a little bit higher compliance rate, and that's because it's fairly simple. I take this pill once a day or twice a day, and pretty much that's all I have to do. Um, the other issue is if symptoms are not overly painful or unpleasant, compliance is even lower. So if you tell somebody you have hypertension, for instance, or you're a borderline diabetic, if they really don't feel any symptoms around that, um, you know, compliance is pretty low. Lifestyle change is more complicated because it involves not just maybe taking a medication or doing something once or twice a day. It typically involves changing all aspects of your lifestyle, from your nutrition to your activity level to your psychosocial um, output. So um, what we did in this course was, and with the textbook, we shifted from compliance to adherence. Now, adherence is considerably different because when you want someone to adhere to a recommendation, you really have to know that person. You have to know the patient, and you have to set mutual goals. Um, the other thing about adherence, you have to understand what the daily activities are. So if you're asking someone to take a medication, for instance, what is their morning routine like? When is a good time to take the medication that's going to coincide with other things that they're doing during the day? When it comes to lifestyle, daily activity is absolutely critical. So you have to really spend time with the patient, really understanding their daily activities. You also have to understand other individuals that affect the person's decision around lifestyle. So, do they have family support? Do they have people that are actually sabotaging? Uh, one of the things that when I was teaching the quit smoking program, um, oftentimes I'd have people tell me, I'm trying to quit, but all of my friends are smoking. So every time we get together, everybody's smoking, and I feel like the odd one out. So you have to understand other individuals that might be involved. And then expectations, sometimes there are short-term goals, short-term effects where you can start to see relief, for instance. Other times it's more long-term. That particularly comes in when you talk about exercise and activity, because most of the time, um, it takes a while for the effort of exercise and activity to really uh, show in a person's life. The other thing about adherence, and this is one of the things that we do in wellness coaching, it's accountability. Okay, so uh, how do you hold a person accountable for a decision that they make? And so it has different forms, and I'll cover that in a second. So, what do we know when you look at all the research? Um, why don't people adhere? Why don't they change their lifestyle or even take a medication? Sometimes patients don't know what to do. So, for instance, you might say, okay, it's important for you to have some exercise or activity in your life, but they don't know where to start with that. So oftentimes a patient doesn't know exactly what they should be doing. Sometimes they don't believe or feel that they can carry out the change, you know. Well, I quit smoking 5 times before, and it never worked because I always went back to smoking. So if they don't really feel or believe that what they're doing is going to make a significant change in their life, uh, adherence is more difficult. Sometimes patients don't believe that it'll make a difference, you know, um, and you know, because especially with lifestyle change, you're asking individuals to really make a pretty significant change in the way that they live their lives day to day. Um, so they sometimes think it's too difficult. I don't have the time, I don't have the resources, I don't have the energy, whatever it might be. And if the treatment is too demanding and the benefits are going to outweigh the cost, then once again, um, adherence isn't possible. Um, it could also be associated with adverse events or sensations. When I was doing my PhD program at UMKC, we did a weight management program. I did it in collaboration with the medical school, and it was for morbidly obese patients. And actually, there were probably 10 or 12 women in this group, and they were all 350 pounds plus. And I'll never forget because I used to do work in kind of a group counseling session with them. And I'll never forget one woman saying to me, you know, I don't want to lose weight because my man likes me this way. And I thought, wow, how can I expect her to make lifestyle change if she thinks and believes that her relationship might be in jeopardy? So really, again, if you really are trying to help people adhere to something, you have to understand some of the consequences of that, some of the barriers, and that's what this session is all about. Um, Another reason is the quality of the relationship between the patient and the healthcare provider is poor. So, the healthcare provider has to show a caring, understanding approach to the patient. And, if they don't have the time, or if they feel it's more of a hassle than try to walk someone through, lifestyle change, and it's easier just to prescribe a medication and get on with it, that doesn't work, especially when you're asking a person to make significant changes. The other is no continuity of care, and the facility is not mobilized towards facilitating adherence. So it has to be a comprehensive approach. Okay, so it's not only the doctor, it's nurses, it's nutritionists, it's fitness folks that are all um, in tune to what adherence really is and what it takes to make those changes. So here's some of the things that we know work. So if you want someone to make a change, and I'm going to be talking about commitment in our next session, but Um, sometimes in fact, every time it's beneficial if they make a public statement about that. Okay. Tell other people that you're going to make the change. I'm going to quit smoking, or I'm going to start, a weight management program. Um, and, it's not just you, but you're holding yourself accountable in the eyes of others when you make that statement. Also to be specific, the frequency, the duration, and the consequences if you don't adhere to what you say you're committed to. So again, having that public commitment and then specific steps that you're going to take to show that you're committed to that decision. Choice. In compliance, you're telling the patient this is what you have to do. When you approach it from an adherence perspective, you're asking the patient, how can we work together for you to accomplish goals that are important to you? So the choice is absolutely critical in that because they know that they're part of the decision-making process. If you can make written as well as verbal commitments, that's helpful. Um, Salient cues. One of the things that I remember when I was teaching the course at Rutgers, um, we had a physician, or it may have been an MPH student. I don't remember, but I remember them saying that, I wanted to floss, and my dentist kept telling me I should be flossing, and I'd do it for a couple of days and then I'd forget. And the thing that made the biggest difference was just doing a sticky note and putting one word on it, floss, and putting it on her mirror in the bathroom. And that cue enabled her you know, to floss her teeth every night. So those salient cues really can make a difference. The other part is self-attribution. So the patient must really believe that they can make the change, and the positive effects of that change are due to their efforts. Okay. And I'm going to talk a little bit about locus of control in a minute here. So then what does it take? Um, I'm a psychologist, and in my training, we make every effort possible to understand what's going on cognitively with our patients. I'm a cognitive behavioral therapist. So, what are their thoughts, their beliefs, their values? Um, and if you're trying to help a patient, for instance, live a long, healthy life, is that really important to them? Maybe there are some barriers to that. Maybe they're not, they think that, what they have to sacrifice to create a healthy lifestyle really isn't worth it. So understanding their beliefs and values it's really critical. And then, of course, making a conscious decision to change. And that's really the starting point because if they really haven't made that commitment, and I'll talk about the stages of change here in a minute, then they're not going to be successful. So the other issue is that most healthcare providers, they don't have the time or the interest. I mean, um, I have friends that are physicians, and they tell me, I'm lucky if I get 15 or 20 minutes with each patient. It's just they have a schedule, and it's very demanding, and they can't offer comprehensive uh, assessment and recommendations for every patient that they have. The other part of understanding mindset is, what is the motivation? So some people, it's body image. They want to look better. They want to look younger, and that's their motivation. I have friends that's number one on their list. Others, it could be health if they're dealing with a health issue. For some, it's energy. They're just tired of being tired all the time. Um, and so to understand the motivation is really one of the first critical steps in helping patients to create a healthy lifestyle. Okay, so how does this work? Could be with a simple question. Tell me about yourself. What kind of problems are you having? You may find that the problems are and difficulties go beyond what that particular health issue is with the person. Um, how does it interfere? How does it prevent you from living the life that you want to live? You know, how will this change enable you to experience a higher quality of life? Have you tried changing before? This is an absolutely critical question when dealing with people that are trying to quit smoking and trying to lose weight because, as you probably know through your own work, is people who lose a significant amount of weight typically put it back on within a year. Those that have quit smoking have tried time and time again before it finally works. So really understanding what they've tried and not understanding whether or not they failed, but what are the reasons, what was happening, what was occurring when they were experiencing that failure. What do you think is causing your problem? And whether or not they see it as a severe situation. And, sometimes the doctor or the physician's assessment of the severity of the condition is much greater than what the patient sees. So to really understand what that means. And then what problems do you anticipate? Okay, if they try to make the change, the lifestyle change, what are some negative consequences of that? Okay, and typically they're able to come up with it, but sometimes it takes a little exploration. So when you think about the mindset, and this is some that came out of my research when I was doing wellness programs for AT&T, corporate wellness program. What I noticed was that some people, um, their negative mindset was denial and procrastination. Okay, I don't have the time. Um, my father and my uncle, they smoked until they were 90 years old, so it's not going to happen to me. Um, it's really not that bad. So when I look at, myself, the fact that I'm, 40 pounds overweight, it's not that bad because I've got a good buddy who's 80 pounds overweight. So what really is there any denial or uh, part of that procrastination behind and including in their negative mindset? Another is discouragement. I tried it before, it didn't work. Um, I was bored. Uh, I used to hear this all the time. I quit smoking, but as a result, I couldn't sleep. I was nervous all the time. I was grumpy. People complained. In fact, my wife even said, "Go back to smoking. You're driving me crazy." So, um, is there some discouragement that you can see there? The other thing that I noticed is that some people are just oppositional. They do not want to be told what to do. If you tell me what to do, chances are I'm just going to do the opposite, or I'll do it when I'm ready to do it. And then another big part that needs to be explored is the external perspective. This is what I find is that with most people that cannot commit to a lifestyle change, they have an external perspective, which means that they're waiting for the outside environment to change before they can feel better, before they can do better. And it's almost like a victimized mentality, but I talk about that in terms of externalized perspective. So when we look at that perspective of the world and of the self, there are two instruments that I've used in my practice. In fact, I've got a link here, and maybe we can send that out to them, Jody, where you can actually take a test. you can see whether or not your internal or external locus of control. So when your external locus of control, um, it's when you're looking at the outside environment as a barrier to your efforts. Okay. Could be that I can't afford a gym membership or I don't have enough time in the day. Uh, and it's easier to stop at a fast food restaurant than go home and cook a healthy meal. That's a very external locus of control. Now, when that shifts to an internal locus of control, you notice that the patient feels like there are things that they can do to actually affect their health and their well-being. Okay. And when I did my research at UMKC for my PhD program, I had the heart patients complete a locus of control instrument. And what I found was that after 3 months of participating in an exercise rehabilitation program, their locus of control increased to locus of control pretty significantly because they, might have started out coming out of heart surgery, thinking, "Oh my God, what am I going to do? I don't know where to begin." But gradually, as they were introduced to exercise, their confidence started to really bloom, and and they were able to increase that locus of control. That also ties into self-efficacy. Self-efficacy is the belief that I can control my situation and I can make my lifestyle or my life or my lifestyle better. Um, so with self-efficacy, by taking small steps and experiencing success over that, um, it's very positive in terms of changing lifestyle. I think did we have a hand up or in the chat, maybe a question? I didn't know.
I stuck that link in the chat.
Okay. All right. And oh, you put it in the chat. Okay. Thank you, Jody. Okay. So, oops, hold on. Let me go back. Now, the other thing that's important to understand if you're trying to get someone to adhere to lifestyle change is understand where they are in their stage of readiness. So the first stage is pre-contemplation. This where they're not considering change. They don't want to hear it. Um, and it's not something that they're interested in. They haven't thought about it, or they thought about it in a negative way, but they're just not ready for change. And by spending a little time with someone, they may reveal that. They may tell you, I'm not ready for changing. Uh, the next stage is contemplation. They're thinking about it, but a person could be in contemplation for months or years. Yeah, I've thought about, quit smoking or losing weight, or I've thought about starting an exercise program. In fact, I've thought about it for the last 5 years, but I never did anything about it. So that's the contemplation where they know that by doing something they could benefit, but they just haven't taken the steps. In preparation, they know where they can change. Okay, so they know specifically the small steps that you can take to be on that path to wellness. And with the action stage, it started. Okay. The other thing that we know through the research is that for lifestyle to really take effect, for a person to maintain a healthy lifestyle along a number of different areas, such as weight or exercise or uh, you know other health concerns, it takes 3 months for it to be sustained. It takes 6 months for a person to maintain it. Okay, so we have a responsibility as healthcare providers to be honest with people. You know, if you're going to change your lifestyle, you got to be in it for the long run. you're gonna start to see some improvements. You really start to make some progress after 3 months. But if you want it to become part of your life, part of your day-to-day activity, part of your lifestyle, it has to be 6 months or more. And the other part of maintenance is that the person is preparing for setbacks because setbacks happen. Okay. It may be something that occurs. It may be a difficult situation. It may be a derailment or a sabotage from someone close to them, but be prepared for that so you're not blindsided. Okay, I'm going to talk about commitment in our next session. Is that right, Jody? Yeah. So I won't cover that, but a lot of what I'm talking about in terms of barriers, it really comes out of my research in looking at how people commit to lifestyle change. And I'm not going to cover this in any detail. I'll cover this in our next session. But what I found was that there are four main uh, kind of pillars, if you want to think of it that way, to commitment. And one is vision. So, really understanding how a person visualizes their success. And what we know through the literature is that visualization not only applies to lifestyle change, but it's a very powerful way of changing all aspects of your life. Um, a lot of research has been done with professional athletes and how they use vision and, in their mind, kind of go through a successful process that really helps their performance. It happens in the business world. I mean, so having that positive anticipation and a clear vision of where you're heading and how your confidence is going to build and how your life will be better. Insight is the ability to know yourself. Okay, have you succeeded in the past? Have you failed in the past? Um, really understanding those mindset barriers I talked about earlier. Are you in denial? Are you kind of you know, a person that doesn't like to be told what to do? So really understanding where you're coming from cognitively, your insight. Acceptance is the fact that when you change your lifestyle, something else has to change. Okay. So if you got a lot of satisfaction out of eating, certain types of foods and you want to lose weight and have a healthier diet, guess what? Sometimes those enticing snacks have to go or they have to be minimized. So, what do you have to do? Um, and how are you attached to your old way of doing things? And, how do you replace those negative behaviors? The other thing I found was that integration is a true sign of commitment. That's when your thoughts, your words, your behaviors are all the same. Okay, so you're not saying one thing and doing something else, um, but you're consistent. And when people see you, when people look at you and what you do every day and what you say and what you believe, they see consistency around your commitment. And that's full integration. Um, let's see. I was going to talk about stress a little bit. I think we might have time to talk about it because what I found was that stress is extremely important when it comes to lifestyle and a wellness lifestyle because stress can be a huge detriment. It can really put a person off course, and it can contribute to a wide range of physical and emotional problems. Um, and unfortunately, most people, when they see or hear the word stress, they have a negative connotation. Okay, but the reality is we need a certain amount of stress in our life, and in the literature, it's called eustress. And if you think about kind of a bell-shaped curve, um, the optimal level of performance is that when your stress is at a certain level where you're focused, where you're committed, where you're into it 100%, that's when you perform at your best. As stress starts to increase beyond that optimal level is when we start to find problems. Okay. Um, and, getting back to professional athletes, or any athlete for that matter, they understand when they have that optimal level of stress that contributes to their performance. So not enough stress can be as damaging as having too much stress. So it's important to understand, how that works in a person's life. When I do my coaching, I have people fill out an assessment. Um, this is something else we might send people if they're interested, um,
Sure.
but it's just a way of you looking at a way to look at stress in your life. Okay. And the other thing that I do is when I used to do stress seminars, I talked about the stress cycle. And basically, this is what it means. So something happens, right? There's an activating event. And when that happens, let's just say, for instance, uh, you're caught in traffic, right? You're running late, you have an important meeting, and the traffic's backed up. First of all, you have a thought around that, okay? And that cognition might be, oh, I'm never going to make it in time. This damn traffic, I'm going to be late. And you start to have that negative assessment of the traffic jam that you're in. And physiologically, things start to happen. So your blood pressure goes up, your cortisol goes up, you may start to sweat, you feel your hands on the steering wheel or all sweaty, and you have a physiological response. And then you have a behavioral response. Okay. So you clench your fist, you might have an angry outburst, you might get on the horn and beep at people. Um, but the thing is, it doesn't stop there because what happens when you finally get to work? Okay. You might have additional thoughts, additional cognitions, right? That are negative. You might lash out at other people, and this is what contributes to that negative stress cycle, where the activating event has a wide range of effects, both cognitively, physiologically, and behaviorally. And to understand how you can get caught up into this and what you can do about it is really critical. Um, okay, so this is kind of what we just talked about. Um, Sometimes I know this happened to me not too long ago. A woman almost hit me. Actually, I was just coming down the road, and she just pulled out right in front of me. I mean, came within inches of hitting my car, and I mean, so I had a cognitive moment, a thought, and also I could feel my body reacting to it, and you know because I teach this kind of a thing, I was able to say, oh, okay, I'm not going to let this ruin my day. That person maybe she had to get to the hospital or maybe to a bathroom or something. I don't know, but I was able to change that thought about it um, to alleviate that negative stress cycle. And this is something we can do. Okay, so here's again physiologically. Um, when we experience that fight or flight reaction and stress. So we have an increase in our catecholamines, epinephrine and norepinephrine. Your heart rate goes up, blood flow to extremities, pupils are dilated. You might tremble a little bit, and and then of course you have an increase in cortisol. Um, and when you have chronic stress, when the stress is with you all the time, that increased higher level of cortisol uh, could contribute to heart disease. So the three stages in fight or flight, the alarm, resistance, and exhaustion stage. And what we try to really avoid is that exhaustion stage. That's when things really start to break down, and that's an effect of chronic stress. Okay, well, here's what I was just talking about. So if you get cut off in traffic, you can think about that in a negative way, or you can actually change your mindset um, so that it doesn't have that negative effect on you. And again, this is something that we typically do when we do stress management programs, and it's funny how people can take this kind of information and apply it to their lives where they may recognize, I've had chronic stress because I've been thinking about this particular person or situation and I can't seem to, get off my mind. But if I change my perspective on it, guess what? So again, these are things that are well within our control. Um, I'm not going to get too much into this because, okay, so one of the things that, again, that I do not only in private practice, but also when I teach seminars, is to understand what a full choice is. So let me give you an example. Uh, so you're planning um, a holiday, a vacation day. You've been looking forward to this for a long time, and it finally gets there, and your family's ready and excited to go out on the special day, and you get a call from work. Okay, you have to come in immediately. We have a situation. Um, so what happens is you have a thought, you have a perception about that activating event, and then you have an emotional reaction. It could be frustration, it could be anger, um, it could be a number of negative effects that you have, just justifiably because you're planning this big day. Um, and so you have to make a choice. And your choice is, do I go into work or do I say, I'm sorry, I've been planning this day with my family and find somebody else? Okay, so you can make both those choices. That's within your control. If you decide, I'm just going to take the day with my family, and I'm going to tell them I'm not coming in. You find somebody else. Okay. So with that choice, what happens? Okay. What's the rest of your day like with your family? Are you thinking, oh, I wonder what's going on at work? I wonder what the repercussions are going to be when I get there. You know, so in a sense, it could ruin your special day because you're feeling guilty or whatever it might be that you're carrying with you into the decision that you made. Same thing the other way around. So you go in, you say, okay, I'll be into work. You go in, and then you're angry, you're frustrated, you're snapping at people, and nobody wants to be around you because you're miserable. Um, and you've made that choice to go in. Making a full choice means, okay, I'm going to decide go with my family or go to work, but I'm going to also decide how I want to feel about that. I'm not going to allow because the reality is I made that choice. So how do I respect myself in my decision making by not carrying that negative emotion or series of emotions with you? And then there are some things that you can do physiologically, like deep breathing, different positive things to avoid being caught into that negative stress cycle. The key here is you want to look at things that put you in control, not someone else forcing a decision on you. But once you make that decision, making a full choice around it. And this is part of wellness coaching that we do pretty extensively. Let's see, we only have about 5 minutes left. So again, this is something when you talk about wellness lifestyle, um, there's a pathway to success. First of all, setting goals. You have to collaborate. Goals aren't something that a healthcare provider tells you to do. It's something that you agree to do with a person that really cares about you and is interested in you. Um, and then, when we talk about SMART goals, the goals there are, it has to be specific, it has to be measurable, attainable, relevant, and time bound. And what I typically do, I think I have one. I keep I keep myself accountable by having goals that I measure all the time. So I have the number of miles that I run, um, days I go for a workout. I chart a number of different things, and it keeps me on task with it. Um, Behavioral contracts, we talked about this earlier. Are you making public statements? Are you tracking your progress? Are you anticipating setbacks that might be happening? Do you have support from your family and other important groups to you? Um, and are you imagining the future in a positive way, that vision aspect of commitment? And are you being patient with your progress? I think that might be where I'm ending, Jody. Um, again, this gets more into wellness coaching, but uh, really important to think about, this how your day is set up for a wellness day. So it begins with your morning routine, um, and your midday, and then your evening routines. Okay, I think we might be at the end.
Okay. Wow, lots of information. That was great, Tony.
Yeah,
Um,
a lot of information. I mean, we could pick up some of this the next time, but um, yeah,
yeah, we'll look forward to it. Um, and we'll get this webinar into a YouTube, and I will email the link to everyone who has signed up for this class today. And I'll also send you the link to the locus control so you guys are able to do that if you weren't able to pull it out of the chat. Um, so that was wonderful. And then our last in the series is going to be March the 12th. So if you guys want to sign up for that, make sure you get a reminder and the link. Again, it's March 12th. And Tony, thank you
good.
so much for taking time out of your beautiful day in Florida to
Yeah.
share
Well, I'm
share
heading
your
down to the
knowledge
pool to
with
be with
us.
my grandbabies now.
Yeah, you go play with those grandbabies. All right,
Okay.
thanks so much, and we'll talk
All right.
soon.
All right. Thank you.
All
Bye
right,
bye.
thank you.